Hello everyone, Dr. Sam Schroetke here at the Physical Therapy and Hand Clinic of Hillsboro with Technique Tuesday. So today, for the next 3 videos, I'm going to be focusing on thoracic pain or mid-back pain. So it's a fairly common complaint we get from people who sit a lot or people who have to do a lot of lifting. Okay, so that's going to be females. If they're having it, they often describe pain in the bra strap area, or guys will just say it's just in my mid-back. Okay. Sometimes, I would even say often, when people are talking about mid-back pain, it's actually something coming from their neck. So if it's pain that's just on the inside border of your shoulder blade, your scapula, pain there is likely generated from your neck, your cervical spine. But if it's actually pain that's right in the middle, right in the mid-back, right in the middle, that's likely thoracic. Or if it's pain that starts here and kind of radiates around, like it's following a rib, that's also likely thoracic. Okay, so if you're having pain like that, you might give this exercise a try and it might benefit you. But again, you're going to want to check with your physical therapist or physician before doing this to make sure that it is appropriate for you. So I'm going to show thoracic extension in sitting. I know they're not the most creative names in the world, but it describes what it is. And I'll show you 2 different ways to do it in this video, and it's kind of a progression of force. So we always want to start out with the lowest progression of force possible, and if that works for you, perfect, no need to progress it. Okay, so thoracic extension in sitting, favorite part, you get to do it sitting. Okay, so what you'll do is in this first progression, you're just sitting about in the middle of the chair. This chair is not the greatest because you see it slants downwards, so that's kind of pulling me into a flex position, so that's not the greatest to begin with, but unfortunately it's a physical therapy clinic and this is the best chair I have for this technique. But anyway, you'll clasp your hands, put them on your neck to support your neck, and then imagine yourself arching from that mid-back area, not your low back. Okay, so support the neck and then arch back as far as you can, hold about 2 seconds, and then back. So we arch, hold 2 seconds, and then back. 10 to 15 reps should do. For most people, that's not going to be enough force. So for most people, you're going to actually have to be sitting back in the chair. Okay. Some people like to be like this and doing it. That works. Or you can have your butt all the way back. Okay. What you want to try to do, though, is get the chair at that point. So you might have to adjust where your butt is in the chair to get that painful spot right where the chair makes contact. Okay, so for most people, it's going to be bra strap mid-back area. So for this chair, I would have to be here in order to make contact with that area. Same thing, now there's going to be a little more pressure because the chair is pushing back on me. Clasp, and then arch the back. Hold about 2 seconds, and then back. This actually feels really good. I might just do this for the next 20 minutes. Arch, and then back. Okay. If the chair were lower, I would scoot my butt out a little bit if I wanted to get that. Or if my pain were higher, let's just say that if my pain were a little higher, I'd have to scoot my butt out. And then, so then the contact point is where my pain is. And then I'm arching this way. Okay. Some chairs just aren't good. Like this is plastic. This might not feel great for some people. So then what you might do is, in comes the towel roll. So there's lots of uses for towel rolls. This is one of them. You put it in the chair at the point where you're having the pain, and then same thing here, supporting the neck, arch back, hold 1-2 seconds, and then back. Okay, hold 1-2 seconds, and then back. Okay, so that's thoracic extension in sitting. You want to go as far as you can. I say in a lot of videos, end range is where the magic happens. So your end range is where you go so far back that you can't go any farther back. You're not going to hurt your back with doing this technique. It might feel a little uncomfortable at first. As you do it, it should get more and more comfortable. Or at the very least, when you finish the technique, if you were having really intense pain, it might be less intense. Or if the pain was kind of wrapping around, it might be now just in the center and not wrapping around. So that's what we're looking for, okay? So thoracic extension in sitting, 10 to 15 reps every 2 to 3 hours. But again, check with your physical therapist or your physician before doing this technique to make sure that it is appropriate for you. Dr. Sam Schroetke here, signing off. Thank you.